Through our joint work with Airedale, Wharfedale and Craven CCG and our partners in the Care Trust and the local authorities, we know that there are a number of people who have complex long-term conditions who are struggling to manage their health and their quality of life. Often people have associated mental health problems and very difficult home circumstances. This can make it even harder for them to manage their health and well-being. So the vision for the Complex Care Service is to bring together a whole range of organisations and services that collectively can provide holistic care for individuals with complex needs to enable them to improve their ability to look after themselves and manage their well-being. We have a range of different staff from different organisations. We have doctors, GPs and consultants. We have nurses with physical and mental health backgrounds. We have a psychologist, a physiotherapist, but we also have staff from Age UK and Carers Resource. These are called our personal support navigators and our carer support navigators. We have people in the service who are able to help people understand why they're having difficulty, develop the skills and confidence to look after themselves in a better way. The team will support people to understand what they want to achieve. So the team will offer guidance, education and support to help people make the right choices for them about their healthcare, to become independent in looking after themselves and ultimately improve their quality of life. A big part of the team is our digital care hub here at Airedale Hospital. They provide the 24/7 access to support for individuals, either by telephone or Skype.
We look to enhance the services that are already around, so we don't take over from any teams. We look to see how we can best support someone. We have 2 huddles every week. Our one huddle is to discuss all our new referrals into the service, and our second huddle is to discuss people that are in our service that perhaps we need to come together again to refocus our thinking and make sure that we've got the right plan of care for people. And these prove really helpful because we're such a range of disciplines and agencies within the room, so we're really able to, in a really nice atmosphere and environment, be able to sort of challenge each other just very gently to be able to make sure that we get the right things for our people that are in our service. The complex care service is important to me because I feel we use a real person-centred approach.
Well, I've been quite stressed because I've had 1 or 2 things going on, and I wasn't sure how I was going to manage them.
A lot of the patients that we get referred have actually had an awful lot of input from medical services, so they often present with both largely physical problems, but with some mental health problems as well. So having a psychologist in the team enables the team and our service users to think differently about their difficulties. The complex care team has been set up to try and manage a number of the gaps that have occurred in patient care around both the psychological and physical health. I think for some of those patients we've been able to meet those gaps, and I think the team have really enabled people to improve the quality of their lives and to gain alternative ways to manage their difficulties.
Been in and out of hospital a lot,
right,
and that had a negative effect on my family. Yesterday we had a meeting with one of the navigators, personal navigators, or if you like, experts in many areas. So they know of what's available, what help is available.
It's not as simple as just sorting out the health condition. A lot of people have an awful lot of stuff going on. For example, somebody may be living with diabetes, they may have arthritis, they may have asthma, all of which are long-term conditions, can be quite chronic conditions, but that may then be exacerbated by the fact that they may be behind with their rent, they may be in rent arrears, they may not be getting all the benefits that they're entitled to, so they've got a lot of financial stress on top of that. They may have relationship breakdown. The role of the personal support navigator provided through Age UK, Bradford and District is there to provide one-on-one support for somebody.
My colleague Wayne phoned me up and said, could you come along to meet a certain gentleman who he felt I could help with. So my first visit there was just to get to know him. We arranged actually the next day to get his hair cut. He's sort of a little bit on his own, and I think the more outside people that he sees and relates to, the better. These people appreciate your time, they really do. Every week now, when I see the lady who needs some help with walking, she offers me a cup of tea, and I gladly receive it.